Today, we will be discussing the newborn hearing screening and reporting process in South Dakota, specifically as it pertains to out-of-hospital births. In this training, we will go over what is the newborn hearing screening, early hearing detection and intervention, methods for screening, the next steps, and how to report. What is a newborn hearing screening? 2 to 3 out of every 1,000 children in the United States are born deaf or hard of hearing. Hearing loss is the most common birth anomaly and is more prevalent than all other congenital defects and diseases which are screened for at birth. Hearing is necessary to grow neural connections throughout the brain and is crucial for developing spoken language, reading, and auditory learning. All newborns should be screened by 1 month of age. 43 out of 50 states have mandates for newborn hearing screenings to be performed. South Dakota does not have mandates, however, most of the major hospitals and birthing centers have standardized protocols to screen newborns before they leave their facility. EDI. What is EDI anyways? EDI stands for Early Hearing Detection and Intervention. It is the national effort to identify infants with permanent hearing loss as early as possible. They have created an easy-to-follow framework to remember the important steps involved with hearing detection and intervention. One, 3, 6. Hearing screening should be performed by 1 month of age. Diagnostic hearing tests should be completed by 3 months of age, and interventions should begin by 6 months of age. South Dakota EDI and the South Dakota Department of Health have increased efforts to screen all babies in South Dakota to be in alignment with national EDI recommendations of screening all infants by 1 month of age. Methods for screening. There are a few methods for screening newborn hearing. One that you will have most readily available to you through the state is automated otoacoustic emissions. Otoacoustic emissions, or OAEs, test whether the sensory cells in the inner ear are working by putting a sound into the ear canal and measuring the output. The South Dakota Department of Health has OAE screeners, which are easy to use and available for midwives to check out for use in out-of-hospital births. This is to ensure all babies are being screened. Trainings on how to use OAE screeners, such as the one shown here, are available through the manufacturer. With that in mind, it is important to remember that OAE machines need to be calibrated annually. OAEs are easy to interpret and use. The results show a pass or a did not pass result. Note that a pass does not necessarily mean that a child has normal hearing. It only tells us that the sensory cells in different regions of the inner ear are working relatively normal. The child could still have a mild hearing loss, which would need audiologic treatment. Risk factors. Before starting the screening, there are certain risk factors that professionals should be mindful of. Here is a list of risk factors from the Joint Committee on Infant Hearing. A few of the more prominent risk factors include a family history of hearing loss, NICU admission, and any craniofacial malformations. A full list will be made available to you following this educational training. OAE screening process. Step 1. Inform the parents and get consent to perform the newborn hearing screening. Step 2. Briefly assess any risk factors that may impact the screening. If risk factors are present, then you should put them on the reporting form. If an infant gets admitted to the NICU, you will not have to worry about completing the reporting form, as hospitals have their own screening protocols. Step 3. If there are no risk factors, or if you have briefly assessed the risk factors and it is safe to move on, complete the OAE screening. If the child passes in both ears, you may discharge and fill out the reporting form. If the child does not pass, move on to step 4. Step 4. Repeat the OAE screener 10 to 14 days after the initial screening. If the child passes in both ears, you may discharge. If the child does not pass, refer to a pediatric audiologist. A resource will be given to you to give to parents subsequent to this training. When to report. After completing the screening and rescreening process, it is important to document that it was completed. The South Dakota Department of Health has a reporting form which should be filled out anytime you complete a screening. Special considerations that you should keep in mind. If a child does not pass the screening twice, even if they are in opposite ears, it is best to have a pediatric audiologist complete further evaluation. If any risk factors are present, it is important to denote this on the reporting form in the comment box. Sometimes children may have to be screened again as they age, and we do not want them to get lost to follow-up. Lastly, a passing result doesn't automatically rule out hearing loss. Parents should continue to monitor milestones with their pediatrician and be aware of any warning signs, such as not startling to loud sounds and not turning their head when somebody speaks. You should always encourage parents to follow up with their pediatrician regarding any concerns related to their child's hearing status. The South Dakota EDDI Collaborative, as well as the South Dakota Department of Health, have resources to help parents navigate through this process.